Welcome to this video on neuropathy. So we're going to go over the different forms of neuropathy. We're going to define neuropathy. First thing, neuropathy is simply damage or pathology to nerves or a nerve. Describe different neuropathies, the different types of neuropathies, because people think, okay, I have neuropathy, that's it. I got tingling and numbness in my feet, it's neuropathy. Okay, but they don't understand the different types, and each type has a different cause. And then we're going to list the possible diagnoses for each type of neuropathy. So peripheral neuropathy is damage or disease affecting, affecting nerves. It may impair sensation, it may affect movement, it may affect glands, it can affect organ function, which is a key thing that people do not even discuss, and other aspects of health depending on the type of nerve that is affected. Okay, we have mononeuropathy, which is one nerve, okay, one site. Mononeuritis multiplex, which is kind of confusing because it is affecting one nerve, but a number of different nerves, and I know that sounds strange. In other words, they're not related. So it could be in different parts of the body. You can have a mononeuropathy in your hand or in your wrist, and a mononeuropathy in your leg. Autonomic neuropathy, autonomic meaning the automatic reflexes in your body, the organic reflexes. So, for example, you're not telling your gallbladder right now to digest certain fats, or I should say secrete enzymes to digest fats. Okay, you're not telling your heart to beat right now. You're not telling your heart rate to increase when you exercise and slow down when you're in bed at night. Right, all these things are happening automatically or autonomically. Okay, so it's autonomic neuropathy, which are the nerves that are going to the organs. And neuritis is an inflammation of a nerve. Carpal tunnel syndrome is the most common type of mononeuropathy, okay, affecting one nerve. And what carpal tunnel is an irritation of the median nerve as it goes through a very small carpal tunnel, a little hole in your wrist. Right? As the nerve goes into the hand, it travels through that tunnel, and that tunnel has a number of different structures, including 9 tendons which connect muscle to bone. So think of them as like 9 ropes, and the nerve. So if those tendons become inflamed, then the inflammation or the swelling will then take up a good portion of the hole and therefore compress the nerve, the median nerve, and we call that carpal tunnel syndrome. And if you notice that this median nerve branches and it goes into it innervates the thumb, the index finger, the third finger, and a little bit half of the fourth finger or the ring finger. All right, so it's very specific as far as the locations in which they innervate. This is a very good picture of what's known as Thenar Atrophy, okay, or Thenar wasting, because what's happened is because of the lack of nerve flow to that muscle, the muscle wasn't being controlled by the brain, and therefore it atrophied. All right, so you can see right over here and over here how this person has bilateral atrophy as a result of bilateral carpal tunnel syndrome. All right, at that point, that's late. We may be able to regain some strength once we decompress the nerve, but at that point in time, this person is going to have a permanent injury. That's why, unfortunately, most people, what they do is they'll start developing tingling, numbness in their hand, maybe even pain, and they ignore it. They shake their hands, they get up in the middle of the night, they get up to shake their hands, and the next thing you know, it's been going on for 6 months or a year. Maybe it starts to get worse. Then they call me, they come in here, and at that point they have severe damage to the nerve. Right? And the fact of the matter is that had they called when it first started after maybe a few weeks, it would have been a lot different condition than after 6 months or a year. Mononeuritis multiplex is a simultaneous or sequential involvement of individual non-congruous nerves, meaning that the nerves aren't connected, they're in different parts of the body, and it's affecting several nerves at one time. It's either could be partial or complete. It evolves over days or years. It's asymmetric. okay, meaning that it could be on both on one side of the body or on the other, or maybe, like I said, the right hand and the left foot or something like that. It typically presents with acute or subacute loss of sensory and motor function, meaning when you lose sensory function, you're losing the ability to touch, to feel. You may have numbness, you may have tingling, and motor is going to affect the portions of the nerves that go to the muscles. So it's going to cause weakness. It can cause pain, a deep aching pain, usually worse at night, frequently in the lower back, hip, or leg. And in diabetes, it can affect the extremities as well. Okay, this is what mononeuritis multiplex looks like. It also causes this rash in your skin, which is basically following the course of the nerves. The causes diabetes. Diabetes is going to be number one on all these lists because of the lack of or decreased blood flow to the extremities. Different types of vasculitides, like polyarteritis nodosa, and there are several others where there's inflammation or infection of the blood vessels. So therefore, again, it's going to be resulting in decreased amount of blood going to a particular area, and the nerves are very sensitive to that blood loss in terms of the loss of oxygen and nutrients, which they rely on just like any other part of the body. Immune-mediated rheumatoid arthritis, systemic lupus also is the cause of it, leprosy, Lyme disease, HIV, or sarcoidosis. All of these can occur and can result in mononeuritis multiplan, but except for the fact that it's rare. Okay, most common one is diabetes. Diabetic peripheral neuropathy. With diabetes, okay, which is the most common form of a peripheral or polyneuropathy, what happens is the nerves are affected because mainly the blood vessels are affected. So you have a decrease. The red is the capillaries, the vein, or the veins are represented by the blue, and then the yellow over here are the nerves. And the nerves will start to die as a result of decreased blood flow. Or there could be damage, of course, because of the fact that once you have decreased blood flow to an extremity, the skin will start to die, all right, and you could get decubiti, which are bed sores very easily, or any other type of skin wound, and that can affect the nerves as well. Patterns of disease in diabetes. This is the most common, where a person will start to develop sensory loss in the feet, and then it'll progress up to the legs, to the knees, and then after that they'll usually start getting it in the hands. But most of the time, patients that I've seen over 30 years of experience with this, we see it primarily in the lower extremities first and then the upper extremities. However, diabetes also makes you more sensitive to carpal tunnel syndrome. So a non-diabetic can tolerate more compression of the median nerve in the wrist than diabetic patients. And therefore they're going to be affected a little bit more so. So they're a little bit more sensitive to it. They have a lower threshold. Polyneuropathy affects many nerve cells. Nerve cells are called neurons, and various parts of the body. They're symmetrical, so they're bilateral. You're going to see it on both sides of the body, except in the early stages where it could start to develop in one leg, and then it'll start in the other leg, or one hand and then the other hand. But they are symmetrical. Polyneuropathy is symmetrical. It progresses very slowly, and it's caused by processes that affect the whole body, not just affecting the leg or the arm or what have you. Distal axonopathy. Okay, now the axons, just picture a telephone cable. You have the covering of the telephone cable, and then you have a number of different strands, hundreds of strands actually, especially the fiber optic cables. Those strands, as far as the nerves are concerned, are axons. They're analogous to axons. So the axons, you have the nerve itself with the covering, and then you have these axons which also have a covering called the synovial sheath. Okay, I'm sorry, did I say synovial? Myelin sheath. Okay, so a myelin sheath covers the nerves or the axons, just like you have rubber insulation on a wire or a cable. So the axons are affected in proportion to their length. So the longer they are, the more they're going to be affected. That's why usually it will develop more in the legs than in the arms, because the nerves are longer going to the legs, actually going to the toes. Myelonopathy, a demyelination. Okay, so I had said that a myelin sheath is the covering or the insulation around the axon. Well, if that breaks down, it's called demyelination. And when that happens, the first symptoms usually tingling, numbness, and then pain. Mononeuritis affects the cell bodies, which are the nuclei, the powerhouse of the cells of the neurons directly. And you have two portions of the nerves. You have the motor neurons and you have the sensory neurons. And there are diseases that affect either motor or sensory, and then there are diseases that affect both motor and sensory neurons. Motor neurons, ALS, although it's rare, it still happens, unfortunately. My mother passed away of ALS, amyotrophic lateral sclerosis, or commonly called Lou Gehrig's disease, because he's the first known person to contract it. But anyway, motor neurons will be affected in ALS. So therefore, ALS patients will not have sensory loss. They won't have tingling, numbness. They won't have pain, unless they get severe contractures of muscles, like in a stroke patient. But they will get loss of motor function. So they slowly lose their ability to contract muscles. Sensory neurons. Sensory neurons are very common. Disease affecting sensory neurons is herpes zoster, which you probably heard of. And that is basically a virus that affects usually one nerve, and it just follows the course of the nerve. So it could be in the face, the facial nerve, and you'll see it in around the mouth, or you also could see herpes zoster in the back, affecting, and that's probably the most painful, where it actually starts around the spine and it comes around the back to the front, and you actually see it right over the nerve. All right, that's herpes zoster. Other causes of axonopathy: metabolic disturbances like diabetes, renal failure, kidney disease, okay, will cause it as well because of the toxin buildup that affects the nerves. Connective tissue diseases like Sjogren's disease or sarcoidosis, that can also cause axonopathy. Toxins, alcohol is very big, and alcoholic neuropathy or axonopathy can be very serious. And people who drink for an extended period of time, a few years or more, and even something as simple. I had a patient a few months ago. She swore that the only thing she had were 2 glasses of wine a day, and she had developed alcoholic neuropathy. Malnutrition, vitamin deficiencies, thiamine, vitamin B1, B6, B12 can also cause axonopathy. Infectious, like Lyme's disease, okay, that could definitely affect the nerves. Drugs, especially chemotherapy, but there's a whole list of drugs, a litany of drugs that is right over here, and I'll even give you a chance if you want to take a picture of this. Because it's always good to have. You may know someone who's taking one of these medications, and they are going to be, or that person is going to be more prone to neuropathy. But chemotherapy also, patients, especially ladies, had breast cancer, they underwent chemotherapy. That's the first question I always ask them, even if they didn't come in with any type of symptoms of neuropathy. I'll ask them, because sometimes people don't really think much of it, because again, when the initial stages, they'll start developing some tingling or numbness in their feet or in their hands or arms or face or abdomen, chest, so forth. Autonomic neuropathy, most common in the latter stages, again, of diabetes, urinary incontinence or retention. So incontinence, of course, is the loss of bladder control, so you could just pee at any time, in other words, if you're not familiar with that term. Or retention, you don't urinate, okay, so therefore toxins are going to build up in your system. GI problems, gastrointestinal, very common for dysphagia. Dysphagia is the inability to swallow, Okay, again, that has to do with the nerves that are involved with the swallowing mechanism. Abdominal pain, nausea, vomiting, malabsorption, so you don't absorb different substances, especially nutrients. Fecal incontinence, again, a loss of fecal control. Diarrhea, constipation. Cardiovascular disturbances. Orthostatic hypotension, those are people that change positions, especially from lying down to getting up or getting up from a chair. They feel dizzy, and it has to do with the fact that the body is not increasing its heart rate fast enough. Okay, this is a serious type of autonomic neuropathy. Inadequate increase of heart rate on exertion. So you start to exercise, and what's supposed to happen? You want to get oxygen to various muscles that need it, and also to your brain. And once you start, so if I go out, I'm a runner, as everybody knows, and I start to run, my heart rate has to automatically increase, and if it doesn't, then I'm going to have a problem. Respiratory impairments with regularity of breathing, so you have irregular breathing. Again, because it's controlled by the nerves. The intercostal muscles and the diaphragm are controlled by nerves. Impotence and sweating disturbances. Okay, you may have the inability to sweat or too much excessive amount of sweating, hyperhidrosis, okay, as a result of autonomic neuropathy. Diabetics, okay, are prone to autonomic neuropathy in latter stages, and I always recommend that diabetics undergo autonomic neuropathy testing, which I do. Unfortunately, doctors down here, they barely even know what it is. I don't know why. I know when I was in New York for the first 30 years of practice, other doctors were sending me patients because they wanted them tested for autonomic neuropathy. So that's something that you need to be aware of, because your physician is probably not. So everyone should be tested for diabetics should be tested for autonomic neuropathy once a year. Treatment depends on the cause of the neuropathy. The most common cause is diabetes, so therefore you must control the blood glucose, and then we take care of the symptoms. Now, unfortunately, just because after the fact, now you start developing neuropathy, peripheral neuropathy or diabetic neuropathy, now what happens is you get your glucose out under control, but the damage was already done. So therefore we need to start treating the symptoms, and we'll get into that in a second. The most common mononeuropathy is carpal tunnel syndrome. Infections, treat the infection, and then we deal with the residual symptoms from the infection, such as Guillain-Barré syndrome. Some people say Guillain-Barré. Anyway, it's pronounced different ways. GBS is what I call it, and that's a very serious disorder that you can be totally paralyzed for a couple of months, and then it takes an extensive amount of rehab, and you could be left with residual symptoms, and they need to be handled as well. My theory, in most cases, there's a lack of blood flow. Okay, whether it's due to infections, whether it's due to compression, whatever it's due to, the fact of the matter is that, again, the nerves are very sensitive to even the slightest bit of oxygen and nutrient loss. So therefore, we have to find a way to increase the blood flow to that particular part of the body. And what I found back in 2004 was laser therapy. Okay, I was seeing all these patients with neuropathy, carpal tunnel syndrome, whether it was compressive or whether it was a post-infection. It didn't matter. The fact of the matter was that there really wasn't much treatment. Okay, medical treatment, you put them on gabapentin, or Lyrica if that doesn't work, or vice versa. They switch them back and forth from one drug to the other, and if they don't work, it's basically you have to live with it. Well, I came across laser therapy, and it works great for most of the cases of neuropathy. Okay, and it's a simple type of treatment that we do here in the office, and it allows for increased blood flow, and the increased blood flow does not allow for creation of new neurons, but it allows for sprouting or branching of adjacent neurons. Once the neurons die, they're gone. Okay, there's nothing that we can do about that, and we can't grow new neurons, but at least we can sprout branches from adjacent, what's known as motor units or adjacent neurons, okay, which is a pretty cool thing. So neuropathy has several different patterns. The early identification of a pattern helps target the diagnosis, and early discovery is the most important thing, okay, as far as treatment is concerned. And then this in turn influences the management of the treatment or the management of the case. Diabetes may present with many different disease patterns, and the causes are diverse from metabolic problems, okay, like I said, sarcoidosis, amyloidosis, systemic lupus, to infection, to nutritional deficits, to autoimmune disease. I don't think I mentioned that before. Autoimmune disease, which is what systemic lupus is, and erythematosus, and actually even ALS may be an autoimmune disease, I have a feeling. Rheumatoid arthritis is an autoimmune disease. Autoimmune disease means that there's a problem with your immune system and your body starts to break down its own tissues. There are proteins. There are identification proteins in every cell of your body, and your body recognizes those proteins as being, quote, self. However, with autoimmune diseases, there are certain cells in the body, certain proteins that the body does not recognize, and therefore what does it do when it sees something that it doesn't recognize? It attacks it, it breaks it down in order to destroy it. So that's an unfortunate thing that does happen in certain cases of neuropathy. Drugs, chemotherapy, and other types of drugs can cause it, and also exposure to different types of drugs, to different chemicals. Chemical neuropathy is somewhat common, not as common as the others. Toxins and other types of substances can cause neuropathy. So that's it. I hope you found this informative, and if this is online, please give us a call, 941-365-6400. And if you're seeing this in the office, this is great information for you. It's always good to know, and I'm sure you know people who either were diagnosed with neuropathy or have some form of neuropathy. Okay, thanks.